Breast cancer is the leading cause of death for women worldwide, but the way countries address it looks differently. Today, we'll talk about how the US, Canada, and Cuba face the challenges of breast cancer. Breast cancer is the most common cancer in women globally, affecting 1 in 8 women during their lifetime. While survival has improved, geography is a factor, which is why comparing these countries is so important. When talking about these 3 different countries, it's important to know that they have different healthcare systems when it comes to insurance. The US is a mix of public and private, while Canada and Cuba both have universal health insurance. Breast cancer is the most common cancer in US women. Survival has improved, but disparities remain. Black women in the US have higher mortality than white women, and mortality is dropping due to early detection and better treatment. In the US, mammograms are widely available, but access is dependent on insurance. Programs have been put in place to help low income women, but gaps in care still exist for uninsured populations. The US offers advanced treatment options from target therapies to clinical trials. However, out of pocket costs can be high, creating barriers for uninsured patients, which influence outcomes. Canada has one of the lowest breast cancer mortality rates globally. Thanks to early detection, public health campaigns, and universal health care, outcomes continue to improve and mortality is decreasing steadily. Canada's universal system provides free mammograms for women aged 40 to 74 every 2 to 3 years, but varies throughout the country. The program is province-based, with mobile units reaching remote areas to ensure equitability. Canada's universal system covers most treatments, but access can also vary. Some oral cancer drugs aren't fully funded, and rural patients may wait longer or travel further for care. Cuba has a strong public outreach and offers free clinical screenings. While equipment is limited, early detection remains a national priority despite economic constraints. Cuba launched a nationwide breast cancer screening program in 1990, which is free. However, with just about 15 mammogram units per 1 million women, with frequent shortages of equipment, early detection is limited. Because of the US embargo, Cuba faces serious challenges in treating breast cancer. This means the country can't easily buy mammogram machines or some advanced cancer drugs, but in response, Cuba has created a biotech sector. Canada offers free screening. Cuba provides free cancer as well, but relies on clinical exams with limited access to mammograms. In the US, access is dependent on insurance, which leaves uninsured women facing barriers. The US has top treatments but is very expensive. Canada they're covered under public health care, and Cuba has free health care but with medical shortages. Survival is highest in Canada, followed by the US, then Cuba. Differences relate to access, technology, and early detection, even though all the countries strive for better outcomes. All 3 countries also face equity issues. In the US, it's cost, in Canada, rural access, and in Cuba, limited medical resources. And like all countries, these gaps are critical for saving lives. The US leads in technology. Canada excels in policy innovation and focuses on equity. And Cuba is creating biotech regardless of inequities. The strengths of these countries are the US has increasing technology for breast cancer, Canada has great access to breast cancer treatment, and Cuba is prevention focused. Canada shows the power of universal healthcare. Cuba highlights community-based prevention. The US drives research forward. Together, they reflect what's possible for global health. Breast cancer doesn't respect borders. No matter the system, every woman deserves timely care, early detection, and a hope for a cure. Health equity must be a global goal, and fighting breast cancer requires more than medicine.